Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health Podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. wildhealth.com for all the information on becoming a patient or working with us.
Thanks so much for listening to the Wild Health Podcast. If you're a Wild Health patient, you might not know, but you have access to our referral program. This gets your friends and family 25% off Wild Health services. Just head to Clarity, and in the top right corner, you'll see Refer a Friend. Click there, and you'll be brought to a page with your referral code. Happy sharing. I feel like when somebody calls me Dr. Stone, it's sort of like when someone uses your middle name. It's
middle name, yeah.
What's your middle name, Carl?
James. Carl James, CJ.
Carl James. I love it.
There was a while in my life where I was trying to convince people I should go by CJ instead of Carl.
Didn't take?
Never really. Didn't take.
Yeah.
People prefer to make lots of hot Carl jokes and stuff like that. And
well, it is hard to it's hard to pass up the opportunity. All right. Middle names aside, you sent me a
wait. Time out. What's yours? Before we move on?
Damn it! I was so close. My middle name is
Really?
Benjamin.
Oh, that's not bad.
Yeah, I mean it's okay. I guess.
What?
I don't know. There's nothing really terrible about Benjamin.
Is Ben Askins listening to this podcast right now?
Sorry, Ben.
Should we bring in Ben Askins and see what he thinks?
Yeah, it's an excellent first name for somebody named Ben Askins. Yeah.
You're right.
Yeah, that's what I get when I get in trouble. At least I did when I was a kid. I got the middle name. All right. You sent me a news article the other day, and like last week, and it was kind of perfect timing because we just finished recording a podcast about PFAS and microplastics and all the really potentially terrifying things that are in our environment that leach into our bodies with everyday life. And you just didn't get enough of scaring me, so you followed it up with the Environmental Working Group, their Shopper's Guide to Pesticides in Produce, which just came out last week. And thanks for that, Carl. More terror.
You're welcome. Yeah, you are welcome. Yes,
so
disruption.
Disclaimer: this is some scary stuff too, but really interesting at the same time. So we'll launch into it. Basically, the Environmental Working Group puts out this Shopper's Guide to Pesticides in Produce every year for like at least the last 10 years. I think more than that. Yeah. And they found that nearly 75% of non-organic fresh produce sold in the U.S. contains residues of potentially harmful pesticides. That's disappointing. How do they do this? They basically take like almost 47,000 samples of 46 different fruits and vegetables. And there's like the USDA version and the FDA version of testing. The USDA like peels and scrubs and washes the produce samples before testing, which is even scarier that they get that many pesticides out of it. And then the FDA removes dirt before testing its samples, but doesn't bother peeling or scrubbing or washing. And even after these steps of peeling, scrubbing, washing samples, the tests find traces of 251 different pesticides across 46 fruits and vegetables.
Yeah, and it's not like some of it is like, oh, there was like a microscopic like trace. It's like 500 times the like recommended exposure in a year or something like that. It's a lot.
Yeah, it's not trace amounts of stuff, and it's not like we found one pesticide on
Yes.
one particular product, right? Like more than 90% of, and we'll talk about sort of the good and the naughty and nice list of fruits and vegetables on this list, but like more than 90% of strawberries, apples, cherries, spinach, nectarines, and grapes tested positive for residues of 2 or more pesticides. And 50 different pesticides were detected on every different type of crop except for cherries.
Yeah.
It's massive.
Wait.
Yeah, it's massive.
Here's
And
the
what
other thing
pesticides
that
are we?
did you go ahead.
No, you first.
Go ahead. You finish.
All right, I was just gonna say
like when we look at
no, you
we're
go.
murdering each other. Well, I mean, when you look at this, one of the things buried in this is that they're not testing. USDA doesn't do this every year on the same vegetable or fruit or whatever produce. They actually have a rotating list. So they're like, some of these haven't been tested since like 2016 or 2011 because they just weren't rotated through. It's not that they're doing it on the same ones every year. So you can have like episodes, like, so for example, if you have significant flooding in an area that has a specific crop, that year may be particularly bad for that crop, right? So if you have flooding in the strawberry fields of California, I don't know if anybody's paying attention, but that's happening. That year for strawberries is going to be particularly bad because you get flooding and then the plants are just bathed in that, in the runoff.
Yeah.
So so some years are worse than others. There's variability there, and then there's some vegetables and produce that concentrate this for whatever reason more or get exposed to it more. Sorry, I didn't mean to.
No, it's all good. No, I was just going to say, like, in terms of like why do we even care about pesticides? It's it's because they're really not good for you, right? So
they're bad.
They're bad. The pesticides that they're really finding the most of and that we're most concerned about are generally the organophosphates, right? And that's like glyphosate. I think one of the where was the neurotoxic one that they found in green beans, acephate, right? So these organophosphates have been linked to obesity, type 2 diabetes, postmenopausal breast cancer, lymphoma. Like there's, it's not to say that any exposure to organophosphates is going to lead to an obvious like causal health outcome that is a bad one, but there's definitely enough evidence out there that I feel very comfortable. I want to limit my exposure to taking in organophosphates in my fruits and vegetables. So I'm on board. You've got me, environmental working group. I believe in you.
Well, I mean, we're talking about substances that were designed to kill or harm other living organisms. I mean, just if you think of it from that standpoint, I don't think there's anybody out there who's like, yeah, I want to expose myself more to things that are designed to harm organisms. Like that's kind of like a bare bones Carl Seger simple way of looking at it. But there's short-term exposure to organophosphates that people get, acute poisoning from. But there's also long-term exposure data around memory loss, depression, and personality changes with long-term chronic exposure to organophosphates, which makes you a little disturbed as well.
Yeah, so the long-term exposure, I don't know, you might get from just eating the same kinds of foods tainted with organophosphates over your lifetime, just for example. All right, well, I don't want to keep people waiting if they haven't taken a look at the nice and naughty list. We'll go through that. That's my inappropriately calendar-themed Christmas way of looking at this. What the environmental working group does is they have the Dirty Dozen and the Clean 15. So, fun branding.
Catchy.
Catchy branding around
Clever.
Something that's totally terrifying. Both of those are trademarked by the EWG, so props to the EWG. The Dirty Dozen this year is strawberries, spinach. They're lumping this into one, kale, collard, and mustard greens. Peaches, pears. I don't know. It seems like a cop out to call that the Dirty Dozen, but whatever. I'll send a complaint letter to the EWG. Peaches, pears, nectarines, apples, grapes, bell and hot peppers, cherries, blueberries, and green beans. So that's the dirty list. The clean list is.
I felt like they could have said the filthy 15, but
that would have been Well, there's your own
names.
there's your own trademark, Carl. You're gonna bring out the filthy 15. Well, the clean 15 is avocados, sweet corn, pineapples, onions, papayas, sweet peas, asparagus, honeydew melon, kiwi, cabbage, mushrooms, mangoes, sweet potatoes, watermelon, and carrots. So this is all publicly available. You can just go to the Environmental Working Group or Google Dirty Dozen EWG, and you can pull these up. But it is, I've known for a while that strawberries, like non-organic strawberries, were always kind of leading the list in terms of pesticides. And, my kids are so sick of going to the grocery store with me. Like, hard stop. Right there, I could just end that sentence, but especially around being in the fruit aisle and having them grab something like, "Oh, these strawberries look really good," and I'm like, and then they look at me and they go, "I'll check if they're organic," because I won't let them eat non-organic strawberries.
Debbie Downer.
Total Debbie Downer. But that's the list, and some things aren't that surprising, right? Like, if you're looking at a list of vegetables that would likely, or fruits that would likely be, harder to make toxic, I would think that a pineapple, like it's pretty tough to penetrate the rind of a pineapple or a watermelon, but whereas something like a peach or a pear where the skin's exposed, like that kind of stuff makes sense. But it's not like this is just a basic intuitive list. Like, why is an asparagus okay, but kale is top 3 on the Dirty Dozen? So this is why the testing, I think, is actually important, is you can get a sense of what's a big issue.
Yeah, some of these don't make sense to me at all, like just intuitively. Like, I think most on the Dirty Dozen list I can kind of get behind. It's the clean ones that I'm like confused by. I actually think it sounds like you think pineapple makes sense. Like, the amount of water used to like grow up a single pineapple, like they get dumped on water, and like you think that just like from a contaminant sake, and then like a sweet potato, it's just sitting in the ground, you'd think that the level of exposure would be high, but and carrots, same thing. Like, that's confusing to me. So it's not intuitive to me, but I don't know. I'm sure there's some like plant biologist out there.
There's
like,
definitely some. Yeah. There's definitely a plant biologist rolling their eyes right now, and they've just shut off the podcast, and that's okay. It's not our demographic. So the big questions that kind of came up for me here were sort of like, what's on the nice list and what's on the naughty list? Fine. What are the health concerns around organophosphates? Well, we've kind of touched on that. And then, like, what do we actually take home from this, other than like living in fear of our environment, which doesn't sound like a healthy, adaptive way to go about your life. I'll take the easy take home, which is, when it's possible, buy organic foods when it comes to fruits and vegetables. I mean, this is not just a plug for healthy eating. There's been a number of large studies recently. My favorite of which was the in Advances in Nutrition. So 2022, this time last year, key findings of the French BioNutrinet project on organic food-based diets, description, determinants, and relationship to health and the environment. And they found that organic consumers had diets that were healthier and richer in plant-based food than non-organic consumers, and that their diets were associated with higher monetary costs, lower environmental impacts, and reduced exposure to certain pesticide residues. And what they've done, also found regular consumption of organic food reduced risk of metabolic syndrome, breast cancer, lymphoma. So some of the same findings as other studies have shown. And they're really just like looking at urinary pesticide levels in real humans. This is not just testing the food. This is looking at, we're looking at urine samples and seeing how many metabolites of organophosphates are you peeing out because you've been eating them in what you've been consuming.
So I'm assuming I don't know the study you're referring to, but like they're controlling for they're controlling for like different choices, right? So I mean, because the obvious, like, the blowback somebody's going to give you on that is like, well, people who are choosing organic foods are actually probably spending more time thinking about their diet and more aware of what they're eating. But it sounds like they're controlling for that by looking at their urine pesticide levels.
Yeah, they're controlling for it as best you can in a study like this. But I think you can feel confident that the organic foods folks were not like the meditating non-smoker group, while the non-organic foods were, drinking heavy amounts of alcohol and chain smoking. So yeah, I mean, it does, by looking at urinary pesticides, I think you get a sense of what you're actually getting in your diet. And, they reported, I think, the biggest sort of elephant in the room around organic foods, which is like organic food diets were associated with higher monetary costs, and like it costs more to buy organic, and that's like a real barrier for a lot of people.
Well, but I think that's where these lists actually come in good. Like, I mean, you look at avocados, they're pretty expensive. Organic avocados, I mean, it depends on the seasonality of it, but the organic avocados, you're buying those certain times of the year, they're pretty expensive. And but if you can look at this and say, hey, if you're having to make tough monetary choices, that's a choice you can make pretty easily. It's kind of number one on the list there of you can buy that. It's not organic, and your exposure to pesticides is pretty minimal.
Yeah. And I think, that to me is the same take home I get from the Clean 15 Dirty Dozen is, do I need to spring the extra like 75 cents to $1 for an organic onion? Probably not. So just having a little bit of a more nuanced way of going into the grocery store and saying like, where does it really pay to buy organic? Yeah, strawberries, blueberries. Definitely. It pays to buy organic apples. It pays to buy organic. And then, if you want to pick up, my younger son's on a mango kick these days, and, seems like a pretty safe food to eat with low pesticides. And, I just love talking about like kids in general, but I wanted to mention that was a memory aid for me, that it's kids who are really the most vulnerable for this kind of stuff, right? I mean, the American Pediatric Association encourages people to check the Environmental Working Group's shoppers list for pesticides in produce for that reason, because we don't, as much as the effects are going to be noticeable in adults, kids are much more sensitive to just both like developmentally and just weight-based are going to be a lot more sensitive to the intake of these kinds of pesticides over time.
Yeah, and I mean, the American Academy of Pediatrics, like their stick on this is like, especially decreased exposure during pregnancy, decreased exposure during childhood, increased exposure during childhood of pesticides is linked with attention, learning problems, and types of cancer. And like, to me, that would be like, you need to avoid these. Instead, they're always, they're a governing body, so they're always like, they never take a hard line on many things. And so they're like, if you would like to consider reducing pesticide exposure in your children, and you're like,
feel free.
If you want to like help your kids' attention and learning problems and, decrease their risk of cancer, then maybe you would consider in the right circumstance looking at this list.
Super compelling.
Sorry, I don't want to burn them down too much, but I was just reading it going like, okay, thank you.
Yeah, it's a little soft.
But
a little soft for sure.
Yeah, a little soft. Yeah.
Well, and I think just to close out this this conversation, we know that diets that are rich in fruits and vegetables are healthier than diets that are not rich in fruits and vegetables as a whole, right? And granted, like, we're not going to get into the debate around like carnivore diets and people with food sensitivities, and there's nuance to all of this, obviously, but overall, plant-based diets are associated with increased cardiovascular risk reduction and other health benefits. So you got to balance this. Like, do I just eat cereal all day long because there's pesticides in my fruit and vegetables, and it's hard for me to be able to spring for the organic foods. There's obviously a happy medium in here, and I think that's where this sort of publication actually can help you make practical choices in the grocery store while you're there. So would encourage people to go out and check it out. If you put in your email to the environmental working group, they give you a nice single page PDF of the nice and naughty list. But you could also just read the report and copy and paste it into your shopping list and decide to pick up the stuff that's lower in pesticides. So we'll leave that to listener discretion.
Yeah, the PDF they give you has like a little lines to cut out. When you print it out, you can cut it out and put it in like almost like a wallet form. I think like it's kind of again.
Do you print out a lot of PDFs, Carl?
Actually, I try not to print out a lot.
I don't print out anything. Yeah. I'd love to say it was an environmental choice, but I think I'm just lazy. Awesome. All right. Well, thanks for sending this thing. It actually
Benjamin Stone. I think we should.
We'll wrap it up, Carl James. All right, CJ. I'll see you next week on the podcast.
All right. Thanks, brother.
Hey, everybody, a quick note about our precision medicine training program. It's been a really popular course. We're constantly hiring health coaches and physicians, but we're only hiring them as we grow if they're trained in precision medicine. You don't get that in medical school or other places. And so we've developed this training program, and we've completely revamped it recently. It's a lot more robust. So now there's still over 50 hours of live synchronous training. There's also all the asynchronous credit, over 50 hours of content. And as a physician, you get about 50 hours of AMA Category 1 CME credit, which is a nice benefit. For the health coaches going through the training program, it's now accredited by the National Board of Health and Wellness Coaching. So graduates are going to meet the requirement to sit for the board exam and become board certified health coaches. So there's a lot of benefits to that, not just the certification, but also when it comes to things like insurance reimbursement. So it's a really robust program. If you're a physician, a nurse practitioner, a PA, or someone that just wants to be a health coach, it's open to all of those categories. There's the 6-month program that's kind of the full program. And then we also have just a fundamentals of precision medicine course, which is completely on your own. It's online. It's all asynchronous. You still get the 50 hours of AMA Category 1, but it's self-paced, and you still have access to the online community, but not all the synchronous lectures as well. So if you're interested in checking that out, go to wildhealth.com/education, and we'd love to have you as part of our next class.